Welcome once again to Stay Alive with Church Alive. And this is your host and president of Church Alive Development Corporation and the proud pastor of Church Alive Community Church. And we're here to bring you a holistic approach to every area and every aspect of our lives. Many people are struggling today to get answers to medical services, and many are getting misdiagnosed or many are not getting the quality treatment. And so the subject that we're going to deal with is medical marijuana. And I have the famous Dr. Thomas O'Brien II. Now, I would say, could I have the add to G in the middle of that? But he's a good friend of mine. He is a famous doctor throughout the city of New York. And he has been servicing the community extensively to the point where he received President Obama Volunteer Award. And if you see the pin that Dr. Birkett is wearing, both of us received it, but it was really because of Dr. Thomas O'Brien and the great work that we did together to bring quality medical services and information to the people at that time in the South Bronx area. Well, Dr. O'Brien is with us, and he wrote a tremendous book here. And it's on the screen. It's called Medical Marijuana, Real Life Success Stories. I read this book, and it really it's an education, it's a study, it's a realization of what medical marijuana is and the advantages of it and how it really makes a difference in the lives of people who are suffering. We're going to deal with opioid and how this is used to make a difference as far as those people who are suffering with pain, chronic pain, backaches, or people who want to get off of the drug situation and get into something that also gives them peace of mind. And so without any further ado, this is my friend, my doctor, and I present him to you now, and I shouldn't because he had his own award-winning Ask Dr. Tommy O's show many years ago, and it was a famous show, and I know many of you can remember it, and I know you missed it as well. We're going to try to get him back on, but I'm going to turn to him right now. Dr. Thomas O'Brien, welcome to Stay Alive with Church Alive.
Welcome, Bishop. It was good to be here with you.
All right, we worked so close at one time, they thought you was a minister.
That's true.
We did so many programs. And so we coined you Minister of Medicine.
Yes.
And because you have holistically were able to bring the medical field and religion and show people that they work together. Now, we're going to talk to you a little bit about going back in history. Tell us a little bit about yourself that people don't know about.
Sure. I am born on Long Island and raised on Long Island, and then I did all my formal education on Long Island. Medical school, I transferred out to Iowa, and that's where I went to medical school. I came back to New York for my residency, specifically the Bronx. I trained at St. Barnabas on 103rd and 3rd Avenue. Right. I practiced in the Bronx. I did my residency in family practice, so let's not miss that point. And I practiced in the South Bronx for 16, 17 years. Mm-hmm. And then I decided to move into Manhattan. I opened up a practice in Manhattan, and I practiced there about 6 years in Manhattan now.
So you've seen the suffering of people over many years.
Absolutely. We know, we know for a fact that the Bronx is the unhealthiest borough in all of New York City. Mm-hmm. And depending on the medical condition, we know that it's one of the unhealthiest communities in America.
It is. It's sad.
Yes.
But you've tried your best to educate the people. I know you're my doctor, and we did a lot of medical clinics and workshops. Mm-hmm. And share with us, because one of the things you found out was that there's a real drug problem in the Bronx, and you tried to address it by educating the people to what was going on way before opioid and all this. You were ahead of it, really.
Right.
Tell us a little bit about that then.
Well, yes. Well, we worked together for over a decade, approaching 2 decades of doing community outreach.
Close to 20 years.
Yeah, exactly. And you were my mentor, and actually that's how I was raised. My parents being educators, teaching me how to help others. And before I went to medical school, I was teaching high school. So using that educational background and then just expanding my audience, and having you as my mentor, and then working together as a team, because we became a team, and then expanding the audience and educating the community on health. Using what I went to school for, health, science came really easy to me. So taking my knowledge and then breaking it down into layman's terms and educating the community on health, nutrition, diet, exercise, and being compliant, and finding a physician that you have a comfortable relationship with. A lot of people feel that they're locked into their physician and they don't have a really good relationship with their physician. Maybe their physician doesn't listen to them. Maybe they have poor bedside manner, whatever the issue is. They feel that they're locked in and they have no choice, and that was the first thing we say, no, you do have a choice. You can change your provider. If you're not happy, it's a relationship. You can change that relationship like any relationship. If you find a physician that you really feel comfortable with, that's your person. Stay with that individual.
Well, I know about that because you've been in my position now close to 20 years.
Yes.
And it's been a blessing because I'm turning 83 years old. And everybody's saying, well, whoa. I said, well, first of all, you got to meet Dr. Tomio and realize the importance that he played in my life. He's making the same impact on the lives of many others. And so I really thank God for our relationship.
Yep.
It's gone beyond that. Our families are connected, you know, and we're looking forward even 4th of July to get together.
That's right.
So this is just... you know, what we're talking about is a doctor that is concerned about not only his patients, but his community. Now, the book is called Medical Marijuana. And to me, when I read this book, it was more than a book of stories.
Right.
It was an education because I had no clue of the value of medical marijuana. But first, for people to go into this area of medical marijuana, they, even doctors, some of them aren't qualified to do that.
That's correct.
You were qualified. How is that qualification?
Sure. New York State's they're very strict. When it comes to medicine in America, we're conservative. And for New York State, we're even more conservative, ultra conservative. So in order to prescribe medical marijuana, you need to take an exam. It's a course, it's 4.5 hours, and then you sit and you take an exam. For me, I took that exam, but after I took the exam, I passed the exam, but I did not feel comfortable enough prescribing the medical cannabis. I prefer to say cannabis. When you use marijuana, I kind of like the first image that comes to mind is the character in Fast Times at Ridgemont High, Spicoli, that the stoner surfer. Hey man, where's my pizza?
Right.
So I prefer to use medicinal or medical cannabis. But I didn't feel comfortable after I took that course. It just didn't give me enough information. It was just the very basic material, very basics. So I spent about another 10 to 12 hours reading in addition to the 4.5. And once I finished all that material, that's when I felt comfortable. And I said, I know this material, I'm comfortable, and I can start prescribing. Up to that point, just taking 4.5 hours, not comfortable, not enough information in New York State's that course that they offer. But then once you pass the exam, you can start prescribing.
You know, the background of where you came from up to this lays the basis for you to be able to handle medical marijuana. Because a lot of people hear marijuana and the doctors is putting people on drugs, you know, or he's part of something, or it's got such a bad connotation, and yet it is a fantastic drug. I learned and realized the value of it. But what was your motive for you to be, take your medical practice and deal with medical marijuana? We're talking about the patients now.
Yeah, sure, absolutely. Well, I'll give you some more background that a lot of people don't know about me. Well, I'm lifetime drug-free. I'm Irish and Italian. I don't drink beer, and I don't drink wine. You figure, Irish and Italian, he drinks beer and wine.
Right, exactly.
I just never was, I never acquired a taste for alcohol. I'm not saying I never had a drink. That's just not my thing. I like Coke Classic. I drink Coke Classic. That's my vice.
Right.
Never did drugs. I'm lifetime drug-free. I've never smoked.
Maybe that's the reason why they call you a minister of medicine.
Well, when I spoke to my friends that I grew up with, and then when I said I'm going to start prescribing medical marijuana, they all laughed because they know my background of being lifetime drug-free, and so they really said yes. I said, about 5.5 years ago, a colleague of mine introduced me to medical marijuana. And he said, New York State's going to pass this. And this aligns with the way you practice medicine. I take a holistic approach. I have a master's in clinical nutrition, so I do not prescribe medications. If I can treat, I do prescribe meds, so let me rephrase that.
Right.
But my first line of treatment, if I can treat naturally, let's say for example, if someone comes with high cholesterol, if their cholesterol is just over what we call high normal, and they're starting into the cutoff is 200. Let's say to 225, 230. I would say, well, let's try diet modification and behavioral change. Let's go on an exercise program. Let's repeat this in 3 months. I'm not going to give them medication first time out. I want to see if I can change their behavior and naturally treat them. So this is medical marijuana. It's natural, and I don't say drug. What I do is I say a natural medication, or I will say, and I prefer natural supplement. Okay? And when I say that to the patients, they really latch on to that. Most of my patients, the majority of my patients now are coming in, they have chronic conditions, and specifically chronic pain, and they were initially put on narcotics, opioids. And the first thing they say is, I want to get off this. And I said, I know. I said, it's changing your behavior. I said, your personality's changed. And I said, yeah, how do you know? Well, because the opioids change the biochemistry in your brain, so you start to behave differently. You start to hear things and respond differently when you're having a conversation with your significant other. And here's an example. A lot of times partners would come in, and I'd say, you have a normal conversation? And I go, yeah. I said, you might say, hello, how was your day? And the other person will interpret that, well, what do you mean? How was my day? I didn't do anything? Because they start to interpret things differently. And it's like, no, I just asked, how are you? So the brain chemistry changes. And so their response is different. And I say, just give me a few weeks. I'll have you off this, maybe a month or so, depending on how long they've been on the medication and the dosage. But as soon as I get them off, the relationship increases, it improves, and everything's back to normal again. Their personality changes to who they fell in love with. It's really great. I've had phenomenal results.
Well, I'll tell you, you've been my doctor for 20 years, all right? And I've been medication-free. People can't believe it, that you're not on any kind of medication. I said, no, but I was taught by my doctor 20 years ago that I don't have to. All I have to do is make the necessary adjustments. I remember the first day, you did my blood work, and you sat down there and you explained every area, and at no time did you write a prescription. You said, just make a little change here, make a little change here, cholesterol up, make a little change here. This is 20 years and no medication, nothing for sugar or diabetes or anything like that. And I'm sharing this with you folks because this is the kind of relationship you want to have with your physician. And I'm not saying that Dr. O'Brien is going to be your physician, because we're here to talk about a book. But I tell you, when he was here practicing in the Bronx, the waiting room was loaded, folk. And wherever he was, there was loaded. And he never turned anyone away because they were getting better. Right. And they were getting off of medication if they were on it. Now, medical marijuana. Tell us about what drove you to when you said people coming in and people, you mentioned just now how it modified and they began to become normal. Right. What is something that people come to you and they want to get off?
When I first opened up my doors, majority of my patients was the full spectrum that was allowed by the state of New York for physicians to prescribe medical marijuana. Over the years, my practice transitioned into pain management. I have patients that suffer from cancer. I have now patients, especially my military brothers, that suffer from post-traumatic stress disorder. They have irritable bowel disease, Crohn's disease, ulcerative colitis. I have a lot of patients that suffer from that. I have a traumatic brain injury where they have problems with their spine. Neuropathy, diabetics that have diabetic neuropathy. And now that category falls under chronic pain. Cancer patients. I have a few other conditions, but my practice pretty much transitioned into pain management, where majority of my patients now suffer from chronic pain. Doesn't matter where the source of the pain is, it's pain. It could be injuries to the neck or lower back, and they have radiculopathy, where the pain radiates out into other aspects, the limbs, upper and lower extremities. But majority of my patients now are it's pain management. They have on pain medications. They're on either narcotics, or they're using behavioral medications that are used to block the pain signal. Again, like I said earlier, it changes their behavior, changes the brain chemistry, and they know something's wrong, and that's why they come to me. Or the pain medicine doesn't work at all, so they're coming to me, and this is their last resort. I do have a few patients, in my book I mentioned one of the patients. They have chronic pain, and they refuse to have surgery because they're afraid if they have surgery, they're going to be crippled. It's going to be worse. They'll be worse off.
Keep going.
Oh, yeah. Don't you want to jump in?
Yeah, I started to. Then I said, I better let them keep going because it was making a lot of sense. And people who out there, I felt they need to hear more of that.
Yes.
Later on, we're going to talk about, how
Some
conditions, and we're going to go into how this book educates. Now, a person could take this book if they have an illness, or if they have a relative or a friend, even a pastor, and you know that somebody's in your church that's struggling. Right. This book is almost a doctor's book on how to deal with these areas of medical marijuana. Right. And so I want to say to those who that this is a book you need to get. That's all I can say. It's a book to read, it's a book to educate, and it's a book to allow you to deal with your friends and relatives. Everybody has somebody with a drug problem. Now, they don't have to have a drug problem, but they got pains. They got back pains and all kind of issues and things that that they've been struggling with. We're going to deal with certain areas as dying dignity in our second half. And I want you to get that, because a lot of people, we know people have gone to play doctors and want them to put them away. Well, maybe there's another way of dealing with dying pain. There are chronic situations that are uncurable. There's areas here. We're going to talk about breast cancer and how does medical marijuana work with cancer, or how does it deal with a person with cancer? We're going to deal with those subjects. They're all in this book. That's why I said you need to get it. If not, firstly for yourself, but then get it and share it with others. Now, they can get this book by going where?
Yes, they can get we can purchase the book if you go to Amazon.com. In the search button, just in a search window, just type in either my name, Dr. Thomas G. O'Brien II, or put in medical marijuana, real life, true success stories.
Okay, let's go into some success stories.
Okay. Well, let me hold on, because we're skipping that. Let me let's cover the motivation behind this book. Okay?
Oh yeah. I asked you that question, and I think I was thinking about time.
That's it.
But we got time, because we're going to have a second half.
Yep.
Okay. So go ahead.
Yep.
Motivation.
Sure. What's the motivation behind the book? Well, first, this was something I've always wanted to do. So it's a dream come true for me. I've always wanted to write a book. Just didn't know what the topic was going to be about. We knew it was going to be about medicine, and I knew it was going to be about educating the community, because it's an extension to what we already do with our outreach. So this is an extension to the outreach.
Or an extension to Ask Dr. Tommy Yo's
It is, yep. It's just another platform to get my message out there. In my office, the success was so great. After 2 years of success, I took a survey, of a patient survey, and I documented it. I have graphs. I send this upstate New York so we know what's going on. So the those who are administrators and the governor, as well as the medical directors overseeing the program, they can track this program. And I decided to say, I'm going to write the book about the success of my patients that are on medical cannabis, medical marijuana. And I wanted to educate the community so they understand that there is a necessity, and it's not what you think. It's not about getting high and stoned, the Spicoli image. It's about, I tell my patients right away, it's a natural medicine or a natural supplement, and my goal is And my mission is to make you comfortable and functional for quality of life. I want my patients to be able to go out and enjoy themselves. I want them to be able to go out to dinner. I want them to socialize again. I want them to go see a movie. I want them to be able to make their doctor's appointment. And so far, I've been able to achieve that. And the key is you have to, like we said, spend time, educate your patient, educate the community. Take time and look, listen, and feel your patient. It's like CPR. I look at my patients, I listen to them, I feel them physically, because I give all my patients a thorough exam. A lot of patients come in and say, wow, my doctor doesn't do that. I'm listening to their carotid arteries, I'm looking in their eyes, I do everything like I did as a family practitioner, but I also feel them physically and emotionally, that emotional component. That's what you do as a minister.
Right.
Well, spiritual education, well, I do the same thing coming from a physician. I want to know, do they understand me? Are they listening to me? Are they looking at me? Are they mirroring me and saying back and repeating what I'm saying to them? But I want that, I understand. When the light bulb goes on, it's like, I understand what you're saying, Dr. O'Brien. And a lot of times I tell my patient when I introduce myself, I say, hey, I'm Tommy.
Right.
And they look at me like, well, Tommy said, because they're used to saying, I'm Dr. O'Brien, or,
right,
very formal. So I'll tease them, well, if you want to call me Dr. O, Dr. Tommy O,
Right.
that's fine. But, you want to call me Tommy, that's fine as well.
I read in the book that some people come to you and they have been taking painkillers and they don't work anymore because I guess the tolerance to pain. Tell me a little about painkillers, but also there is how would you call it? There's something that also can happen to you by taking too many painkillers, and they're not that because if one doesn't work, take another one. Like some people take 2 aspirins and eventually they're on 4 aspirins and there's 6 aspirins,
Right.
And what's happening there, and how does this change? To cannabis is going to make a difference.
Absolutely.
In their lives.
Well, there's a lot behind that. As a physician, I have my viewpoint, and I feel that, again, practicing in the South Bronx, I feel that the education, the physician's education is not strong enough. Right. I've seen a lot of hospitals, they discharge their patients from the ER, and the first thing they do is they start them on a narcotic.
That's right.
They pierced the narcotic ceiling. Instead of starting them on Tylenol extra strength, an NSAID, like a Motrin, so, start them very low, because once you pierce the narcotic ceiling, you cannot go back to a Tylenol or Motrin. It's just not going to work. Right. This is a narcotic. It's a synthetic heroin, depending on what the category is. And you develop a tolerance to it. We have receptors in the body. And just like shooting heroin, it's exactly the same. It's just that a physician is prescribing it. The body doesn't know the difference between you shooting a needle or prescribing a pill and taking a pill. The body's going to react the same way. So we have receptors in the body, receptors in the brain. Then we can go into the amygdala, and that's the part of the brain where we have the pleasure zone, and you get a little rush out of it, and you're going to crave it. Doesn't matter what it is. It could be sex, could be alcohol, it could be gambling. Something it could be sugar. Okay, you get a sugar rush. So that's the part of the brain where the pleasure zone, the amygdala, that part of the brain, and you're going to start craving more because you're going to want that sensation and you want to continue it. However, you develop a tolerance because the receptors start to what we call downregulate. I don't want to get too much into biochemistry, but every time you use a substance, the receptor in the cell starts to sink and get deeper and deeper, and we need to recruit more receptors for that chemical to latch onto, to bind onto. We call it an affinity. So we would need to drive more medicine in to try to get that same sensation in the brain, because we want that trigger, that signal in the amygdala to say, oh, that sensation.
Right,
okay.
Right.
So as you increase the number of pills, the milligrams, you're gonna keep driving this. It becomes a futile cycle. It's a downward spiral, and the longer you're on it, the more you take it, the more you're gonna crave, or you're gonna want more, because your body's trying to get that same sensation again, and you're not going to be able to achieve it. So you're going to keep pushing more, taking more, and we're going in the wrong direction.
Now, I noticed here you had one story about a gentleman that came in, and he was in the same situation. And then you were able to adjust him going into medical marijuana.
Yes.
Tell us about that.
Yes, I had the name of the chapter is chronic pain and polysubstance use. Unfortunately, there's side effects. We have what's called a therapeutic window. A therapeutic window is a window where the serum level is at the most efficient, okay, where the medication is really working. You can have a subtherapeutic, meaning that the serum level is not high enough and you're not getting enough out of the medication because it's just too low. And then we have above the therapeutic window, we don't say super therapeutic, we call it toxic. And when you go into the toxic range, the side effects really start to increase. It becomes exponential. Even when you're in a therapeutic window, you could have side effects, but we try to minimize it. And that's why we say use the minimum to get the maximum out of it. First lesson I learned in pharmacology, day one, first statement out of the doctor's mouth was, we had over 200 students in the lecture hall, and we were pin drop silent when the doctor made this statement. The first statement was, all drugs are poisons. We just control the amount of poison for a specific, function. Okay?
Right.
When we heard that, we're like, what are you talking about? This is medication. This is good. A doctor is prescribing this. What do you mean poison? So we had to understand that drugs are poisons. We just control the poison for a specific function. So knowing that, looking at this, and I'm looking at the individual, when I did a history and physical, this individual wasn't responding, wasn't making eye contact. The significant other did all the speaking on the patient's behalf. The patient wasn't there. The patient pretty much was a zombie. It was just a shell of an individual. So I said, just give me a little time. Let me see if I can back this off. And this was the sequence of events. There were side effects, and as a second physician would come in, prescribe medication to offset the side effects of the first medication. And that medication would suppress the first medication, and it wasn't working as well, wasn't as efficient, so the first physician would increase the dose of that medication, side effects, and the second physician would increase the second medicine. So it was just going back and forth.
It's a cycle.
It was a cycle, and the medication, the doses kept getting higher and higher and higher, and pretty much the patient was being drugged to death. The patient was in a toxic range. So I said, we have to change this. We need to strip everything down. I had to be very careful and slowly back these medications down while I was increasing the medical marijuana. It took about a month or two. The patient, the first follow appointment, little change, not much, little change. The fourth month, the patient was significant change. The patient was seeing improvement. The behavior, eye contact, patient was speaking to me again, and now I finally met the patient for the first time. And the significant other gave me a big hug and say, I have my partner back. This is who I fell in love with. Yeah. I couldn't believe it. And I said, this person has to be in my book. And
Just actually save the family.
I said, save the person's life and save the family. Absolutely. I just want to make one point clear. Within this book, I have disclaimers. Everyone in this book, they gave me permission to talk about their story. There is no names, no identifying information. They're protected by HIPAA, but they gave me permission, written permission, to talk about their story. So when you read their story, and I wrote this like a textbook without being a textbook, so the reader, in layperson's terms, so we can understand this book.
Well, we're getting ready now to go into part 2 of this program, and I would like to say, ask Dr. Tommy O. But the program, part 1, I know you've really been enlightened. Well, we're going to have part 2, and it's called Medical Marijuana, Real Life Success Stories. And you'll hear some more of these stories, and we're going to also look at in some of the areas or categories of which medical marijuana has been a success. Stay right with us. We're going to take a break now. We're going to come back to part 2 of medical marijuana, real life, amen, success stories. I like to put a circle around that, success story. Now, you can also get the book Stay with us. It's in Amazon.
Amazon.com.
Amazon.com. Get it, folks, and you will appreciate having it. And then you can put it in your library of information, and it'll be a good research book when somebody comes up and tells you, I've got a problem. So stay with us. God bless you. We'll be right back.
Yes, it seems so very simple. Yes, it seems so effortless. Just receive.